Good evening. I'm Mayor Ron Nirenberg, tonight with Commissioner Justin Rodriguez from Precinct 1, Bexar County, as well as Dr. Junda Wu, who's the Medical Director for San Antonio Metro Health, and Dr. Ken Davis, who is the Chief Medical Officer of Christus Santa Rosa. This is our COVID-19 update for the San Antonio community. We continue to emphasize that this virus does not discriminate, and we are still in the middle of a pandemic, and we do have tonight another 954 new cases of COVID-19 to report in our community. That brings us to a total of 17,679. Tonight we have 6 new deaths to report, and let me take a moment to explain some of the numbers here. We have Hispanic males, 3 Hispanic males, one in his 30s, one in his 50s, one in his 70s, and we also have 2 white females in their 80s and 1 white female in their 90s. In addition to that, there are another 13 deaths to report tonight through the Metro Health PostMortem Surveillance program with the Bexar County Medical Examiner's Office. This is one of the few programs like it in the country, and it allows Metro Health to collaborate with the Medical Examiner's Office to better understand the impact of COVID-19 in our community. You may have seen national reports previously over the last few months about deaths related to COVID-19 that were not tested, and this is one way we can get at that data. If a person passes away and has a reported history of signs and symptoms of COVID-19, but lacks documentation of a test being done, the medical examiner, in partnership with Metro Health, tests them post-mortem and reports findings to Metro Health. This process takes a little bit of time to validate. These deaths occurred over the last 3 weeks, and Metro Health now verifies all that data, reported to confirm that there are no duplicate cases reported. So these are deaths, again, that occurred over the last 3 weeks that were now validated post-mortem, lacked a test, but now we can determine the cause of death. Demographic data from the postmortem program is reported in aggregate, not separately, but you can see the comprehensive data on our website, COVID19.sanantonio.gov. But I do have to mention, and we say this every night, behind every data point is a person with a life lived. Our hearts are with their families, their friends, and their loved ones. Our hospital systems tonight remain under high stress. We do have 1,216 people in the hospital, which is up 11 from yesterday. There are 399 people in ICU, which is no change from yesterday, and 231 on ventilators, which is down 1 from yesterday. So that's a significant stress on our hospital system, but I do want to mention that the acceleration of data that we've been seeing over the last few weeks is starting to slow, which is a good sign. However, I do want to also mention that we now have 35% of all hospital admissions are COVID-19 patients, and at this point we have 45% of ventilators available and 11% of hospital beds available. I'll turn it over now to Commissioner Rodriguez.
Thank you, Mayor, and of course we also join in offering our prayers and sympathies to the lives lost recently. It also underscores the severity of the situation. I had the opportunity this past week to visit the Freeman Coliseum. As we all know, those that have been in this community for a long time, the Freeman is kind of a center for emergency operations and has been, whether it's for a storm-related event, hurricane, evacuees have assembled there. Currently, the Freeman is set up for overflow space for our hospital system, which has been mentioned has been stressed out or close to being stressed out. We have about 80 beds that are set up at Freeman, but capacity to set up to 200 over the next few weeks. So for me, it was a stark reminder as I visited that we certainly are not out of the woods, and we're towing a very dangerous line here of having to activate our hospital beds at Freeman. The other thing I want to mention quickly that the county is working on, we know the last few months have been very trying on everyone, particularly as it relates to our mental health. We're working on 2 initiatives at the county in conjunction with our partners at the Center for Healthcare Services. The first is a mental health initiative for frontline workers, our healthcare workers, and their families. We know that no one has been under greater stress over the last few months than those who are treating and caring for our COVID patients. This will obviously impact not just the nurses, the clinicians, the doctors, but their families. So we're working on an initiative to assist their mental health. The second is an enhancement to our mobile crisis outreach team through the Center for Healthcare Services, which responds to calls through our 24-hour crisis hotline. We have trained professionals there who can help with intervention and also reduce interventions by law enforcement and inpatient hospitalization. So important note on that is it also does include the Children's Mobile Outreach Team. We know our young people are not immune from the mental health pressures and stresses, particularly as we contemplate whether or not they're going back to school in a, I guess, traditional setting this fall. So for those children, please, family members, if you're in need, you have any questions or doubts about whether your kids are being impacted, please call the hotline number, which is 210-223-SAFE, S-A-F-E. Thank you, Mayor.
Great. Thank you very much, Commissioner Rodriguez. And I do want to report testing numbers continue to be up. We had over 1,000 tests conducted yesterday at Freeman. Also tests being conducted at Cuellar Center, Scobie Middle School, Kazan Middle School, also very active in our testing regimen. Before we go over to questions, I want to remind you that you can get text updates on COVID-19 in our community by texting COSA.gov to 55000. You can also check the website at COVID19.sanantonio.gov. Dr. Wu is here, and Dr. Wu has been working on throughout our community throughout this pandemic on very aggressive testing and preparations of our long-term care facilities and other congregate settings. And occasionally we do have challenges in those particular settings. And I did want her to brief us a little bit on one particular challenging congregate facility and what's going on there to help prevent and contain the spread of the disease. Dr. Wu?
Sure. So you're talking about Windsor Mission Oaks, where we received a report yesterday of 66 positive residents, and we have one positive staffer as well. So I do want to point out that a lot of those people are without symptoms. In Bexar County, we've been having nursing homes that have even one positive do something that's above and beyond what the state regulatory agency requires, which is to follow a CDC guideline to retest about every week the people who were already negative with the last test, and keep on retesting every week until you don't find any new positives. So that way you can separate out the residents who are positive, and we call that cohorting. Staff who are positive can be excluded from work for a little while, and that's a way to quickly stop transmission in its tracks. So when you do that, you're going to find people who don't know they have COVID and don't have symptoms, and that's what happened at Windsor Mission Oaks to a very large extent. And they have a large behavioral health population, so it's more challenging. But we have been helping the state, who's working with them. We've been providing them with testing supplies so that they can keep on doing that serial testing. And for some of the people tested, for a lot of the people tested, if they don't develop symptoms by Monday, then they'll already have recovered.
Great. Thank you, Dr. Wu. And that, again, you can find on our website. We also have COVID19.sanantonio.gov. You can see all of the congregate facilities that are being tracked that have positive cases. Again, we're taking the approach that you need information, you need the data to make good informed decisions for yourself, your family, your businesses. And that is the approach that we've taken from the very start. So we will continue to update on facilities that have particular interests, and that one certainly is one of those facilities. So thank you, Dr. Wu. At this point, we have Dr. Davis, Dr. Wu, myself, and Commissioner Rodriguez available for questions.
Sorry, Dr. Wu, I had a hard time hearing. Do you mind just going down the logistics again of this facility, the name of it, the number of cases?
It's Windsor, W-I-N-D-S-O-R, Mission Oaks on Roosevelt, and they have 66 positive residents and one positive staffer. And almost all of those residents have no symptoms.
And again, the city was tipped off by what again?
Well, they reported a staffer. A lot of nursing homes have reported staffers, and usually that's community transmission. So a staffer was at a family gathering, had symptoms, goes and gets tested, and then even though it wasn't from within the facility, that gets reported to us, right, as associated with the facility. So that triggers us to go in and say, hey, we want you to follow the CDC guidelines and start doing this weekly testing. And we can help you with that if you don't have all the supplies.
Can you talk about how different this facility is compared to another that is not a nursing home? And even though they don't have the symptoms, how crucial it is to follow with this community?
The reason that nursing homes are different is that the people are a lot of times more close together, and it's a more communal setting. So unlike, say, an apartment complex, the people don't necessarily always have the space. There's even the physical space, the shared airspace. There are a lot of things that make transmission happen more readily in a communal setting like that. You've got that staffer going from room to room, and so if they're not being meticulous, donning and doffing their PPE between every room, that can cause transmissions, so that's why.
What should families know right now that they're hearing this for the first time? Maybe they didn't even know about it.
They're not hearing it for the first time. Under the Centers for Medicare Services guidelines, all families have to be notified within 12 hours, and all the facilities we've been working with have done that.
Have they been recommended to maybe take out some of their loved ones? Is that a recommendation from them?
Oh, no, that's really a last step, because there's a reason typically that people are in a nursing home, and it's that the family is having a hard time working with them. So what we try to do is support the nursing home to have the best practices and yet still be able to keep operating.
Does the River City Care Center have anything to do with this particular nursing home? Because I thought this was a setup to put patients that tested positive from these facilities.
Well, that's true, but I think it's a challenge to take this many behavioral health patients at once. And these are people, also, anybody, but especially an older patient, which a lot of these are older, especially behavioral health patients. They don't relish just being picked up and moved someplace else. They're comfortable where they are. There are enough of the facility is positive that you have entire hallways that are positive, so we're not worried at this point about transmission from the positives to the negatives as compared to when you just have a few positives. So they've got, for their small group of positives that they have left, they're going to be setting aside a special area that I know state regulators will be looking at to make sure that it's safe.
When we say 66, how many in total residents is at this facility?
How many are there total? I don't have the exact number for you. I'm going to ballpark 100-ish. I'm not sure.
Going back to the 13 deaths, Mayor, just for clarification, did those people pass away at the hospital or outside of a hospital?
Most likely, these were patients who passed away at home or some other facility, because again, these causes of death were determined post-mortem. The testing was done post-mortem, exhibited signs and symptoms, but never tests were done. And so these were brought to us in a report from deaths that took place over the last 3 weeks in this post-mortem surveillance.
How does it work for death reporting with the hospitals? Is there some type of specific procedure you're working with the Department of State Health Services or whomever it is that you're reporting to?
Well, we report all hospital deaths, as you know, and any positive COVID to report it, even if they don't die. So they can match the positive COVID and the hospital deaths. So if we know a reason, it's a reason. That may not be the primary reason, but that's also a positive COVID. So it's reporting both on the death certificate as well as to Metro Health and Department of Health Services.
I guess I'm wondering what the turnaround time is like. How quickly are you obligated to report that to Metro Health?
We got the positive tests are reported the same day. We have a list every day of those that are positive in the hospitals, and that list goes to Metro Health every day.
And the deaths?
Deaths go to health services. Usually when the death certificate is done, which may take a few days before that gets completed to go, because the doctor often wants to get tests back to make sure they've got all the reasons there that the patient may have died. So 3 or 4 days.
Dr. Davis, we know about wearing masks outside in the public. It's super important. But recently, the Texas Division of Emergency Management said to consider wearing a mask at all times, even inside your own home. Is this something that is being discussed and recommended?
Well, it depends on your cohorting, is to use the term Dr. Wu used, the cohorting. If people in your home are often positive and you don't realize it, we've had lots of people with the 16-year-old who goes out with friends and comes home and is asymptomatic and infects the entire home. So at times a mask may be useful in the house because you're never really sure where people are and what they're doing. So it would be the safer thing to do.
In terms of staffing at your hospital, how is the situation right now? Do you need more nurses?
We do need more nurses. We're getting more nurses. We had new nurses today we were orienting. We need those with ICU expertise, nurses and therapists. So we're getting them from the Department of Defense, from the state, and of course from Christus Health. There's 60 hospitals in Christus altogether around the country. So we're getting other doctors and nurses from Christus coming in as well. So we do need more nurses. And like I said, we're working the nurses hard. And when they're fully gowned in the PPE, it's exhausting. Working a 12-hour shift is a long time caring for these very sick patients. So we don't want to work them too many days in a row.
There has been some news that the nurses who are coming into San Antonio that are deployed by the state or the Department of Defense are getting PPE daily. Meanwhile, some of the employees at the hospitals are having to reuse their PPE. Is there a difference in what is being given to those people who have just been deployed here versus those who are employees of San Antonio hospitals?
I'm not aware of that. And of course, if they're in the ICU, there's a different PPE requirement than if they're not. And often those nurses that are coming in are ICU nurses, but they're getting the same PPE that our other ICU nurses get as well.
Where we're at right now in terms of nursing, as kind of the larger scale of the county, do we have a total number of where we're at right now? And is it the exact amount? I mean, you're saying you would want more, so how much more do we need?
Well, we actually sent in a list today from each healthcare system to STRAC as to what our needs would be. So we're looking at 190 just for Christus. Of nursing staff that we would need to manage. You know, when we get 500 nurses in here, that's for the entire South Texas. So those don't all stay in San Antonio, and certainly not all at one hospital. So we've got a list that we need going forward that we submitted today to STRAC. I don't have all those exact numbers, but I saw ours that were 190 or so that we need.
Dr. Davis, younger people are getting infected with COVID-19. Do you worry that in a number of weeks from now, we're going to see that pandemic kind of shifting and spreading to the elderly?
Well, we are seeing younger people even dying now with COVID, and they certainly could infect others. There's also long-term sequelae that we're seeing from other countries in younger people. They may have headaches, they may have weight loss, they may have joint pain that's lasting months, even after a minor infection. So I think we may be seeing more long-term sequelae from the infection, but certainly they can infect others. And I was talking today to a group of young people, and I said, you know, it's not just you, but you want that hospital to be available if you have an accident or you have an appendicitis. You want there to be beds there for you. So even though you might not be sick and go to the hospital with COVID, you need the hospital for something else, and you want those beds to be available then. So just trying to get to them what's in it for them.
Earlier this week, we talked about BAMC and wanting them to accept COVID patients. We had 2 congressmen today send a letter to the Department of Defense. The judge had mentioned that we were still waiting on a response. Have we heard back? And just remind us again where we're at right now in terms of hospital capacity, why it would help for them to take these patients.
Yeah, to my knowledge, we have not received a response yet.
That's my understanding too, and I think we're still at about 11% capacity with the hospital's bed space is what I understand. So, but we've not heard anything back. I talked to the judge this afternoon, and he had not gotten a response yet.
Yeah, and we haven't at the city either. And to be clear, BAMC and our Joint Base San Antonio operation has always been helpful and continues to be. They're a center for trauma care. The challenge for us, though, is that we have such an increase in the number of admissions that are related to medical, particularly COVID, but they cannot treat for any medical purposes, particularly COVID.
Earlier this week, we talked about the caller ID, the SA Metro Health that was pushed out. Is this currently already being used, and is Is there any update on that?
I don't think it's already being used. I'm sorry, I don't know the date that it's going to start, but somebody in my department knows, and so we can get that to you.
So it's not being used just yet, but the initiative has been put out? Is that?
It's going to be, it may be in use, it may, I don't remember the exact start date, so I'll try to find out for you.
Trying to get an answer here in just a second.
Yeah.
Dr. Wu, if you could explain maybe the difference from the last major congregate setting that we had in a nursing facility was the Southeast nursing one. Could you maybe explain what you have learned in maybe tackling this one that we have with the Windsor Oak?
Things have changed a lot in the last just couple of months. I mean, it seems like it's been a long time, but that's not the answer I was looking for. Okay. So in the beginning of this response, a lot of the nursing homes didn't have enough PPE, and now thanks to STRAC, that's changed. Nursing homes were prioritized, I want to say around February or March, along with hospitals, so that they do have enough. There are more nursing homes that are getting their staff fit tested for the N95 masks, and the availability of testing, even though it's still really tight, we would not have been able to assist with testing like this a few months ago. And that's a tribute to all the efforts statewide and locally, all the people working together to increase testing.
Do we expect that over time we'll see a buildup of deaths either that are reported within 4 days of the hospital system, or we learn from the medical examiner's office of people who we either didn't know or that we knew but they just in bulk sent them to Metro Health? Like 19 is a lot, and I imagine that we'll report 19 people today, but I imagine that could have been over how long of a period of time?
So that was data over the last 3 weeks. Again, it takes some time to get through. I will say, though, on your overall question, are we going to see more deaths in our community? I think the answer is unfortunately yes. I mean, the severity of COVID-19 cases has increased along with the number of hospitalizations. We have tonight 400 people in ICU, just about, and another 231 on ventilators. And we know that if you are intubated with COVID-19, survivability rate goes down dramatically. And so, we hope and pray for those who are in the hospital, but, these are very severe cases.
Mayor, do we know that of those 13 that were unreported, you mentioned that you don't know if they died in a facility or maybe at home. Do we see that the number of DOAs has increased here in San Antonio?
So, I'd have to defer to Metro Health on that last part of the question. But again, these are deaths that occur in our community that have symptomatology of COVID-19, but no testing. And this is one of the few places in the country that is now doing post-mortem surveillance to determine cause of death if there's a suspicion of COVID-19. And so we are doing that. We're getting that data back. And this first batch of data of the 13 cases, of those 13 cases, the cause of death was determined COVID-19. But there were no tests, PCR or otherwise, to determine that until after death.
So going forward, is the medical examiner's office going to be enforcing or conducting COVID-19 tests on everybody that goes through their office?
If there's COVID-19 symptoms suspected, yes, that's my understanding. That's the purpose of the operation.
And if they don't already have a test result, right? So a lot of people in the hospitals have already been tested. That's why this is more people who did not die in a hospital.
But for people that are dying at home,
Right, so if yes, they will absolutely be able to do that. And I think, like the mayor said, they would prioritize situations where it seems like that was related to why they died.
And the purpose of this partnership with the Bexar County Medical Examiner's Office and Metro Health is to give us a clearer picture of what COVID-19 is doing in this community. I mean, these are deaths that occur again, without any data to determine COVID-19, but symptoms to make it suspected. And so we go in after to determine whether or not COVID-19 actually has taken that person.
Do we have any numbers or data that pertains to people that have died at their home?
Other than this post-surveillance data? I mean, I'm not sure what else would.
Yeah, not that I'd have to get back to you. And as far as the caller ID, that one has started already, so I can tell you that.
So is this the first time that this partnership between the medical examiner's office, is this the first group of people who have been tested for COVID-19 if they've been said to have symptoms?
My understanding is that this has been occurring for, the surveillance has been conducted for a while. It's already in our aggregate data. This was a batch of data that occurred over the last 3 weeks, though.
Right, there was, I'm not going to remember the exact day that the machine was provided to the medical examiner's office, but since then, they've been using it regularly to do testing, and yeah, the 13, they had been testing even before the last few weeks, correct?
So the people who were included in the total deaths would be people who were counted through the medical examiner's office previously?
Yes.
Yeah, I think so.
The previous medical examiner's data would have
Yes.
been included in our
Correct.
aggregate data, yeah.
Correct.
Thank you.
All right. Thanks, everybody.